Hello guys, and welcome back to my channel. Welcome back to the another part of cardiology. So in this part we are going to talk about hypertension, rheumatic fever, acute pericarditis, INR ratio, and some basics of ECG. So hypertension is what? It is a condition in which the blood pressure in the arteries of the patient is constantly elevated. So we need some procedures. Some procedures need to be done so that the patient can be stabilized. So everyone know about what is hypertension. Let's get to the cases right now. So since the examiner also knows that you know about hypertension definition, even the classification, which I'm using this one in the croc questions, which is fine for using in the croc question. However, the ranges, or there are a lot of different classifications for the hypertension. So the examiner is trying to ask you the drug of choices for the hypertension. Let's see the first question. The first patient is 65-year-old. Patient was prescribed the pharmacotherapy for essential hypertension with concomitant ischemic heart disease. 2 weeks later, he consulted the doctor about the dry cough, which the examination detect no signs of acute respiratory or viral infection or the damage to the bronchopulmonary apparatus. What side effect of ramipril is suspected the replacement? So the patient was taking ramipril for his problems and he got the dry cough. So now we need the replacement of ramipril so that the patient can get done with this cough. So the dry cough, when there in the question it is highlighted. So valsartan is the replacement. So when the side effect of ramipril is occurring in the patient, then remember to prescribe valsartan to the patient. This will be the next drug of choice. Next question, they ask about risk factor for hypertension, which are endogenous. It means which are the internal factors which you cannot change. So these are the age over 40 will be a risk factor for hypertension. Sex of the patient will be the hypertension. Like in a male it is differently explained, it is in female it is differently explained. The hereditary predisposition, that if we got something from in our genes itself, like the previous history or whatever are the other factors, you know about them. Let's see the next patient. This was the direct question, by the way. Question is easy, you will understand it. Other options were blah blah, which are not even which were not even close to mark the another options for the hypertension. Endogenous, I have explained something in the social medicine video. If you haven't watched, endogenous factors are something which we cannot change, like the age is the endogenous factor which we cannot control or we cannot change it. Next patient says the high BP. And also says that narrowing of the retinal vessels, father's history of cardiovascular diseases. What should be prescribed to reduce the patient risk for the death caused by the cardiovascular diseases? So if we prescribe enalapril to the patient, so this is something particular for the cardiovascular diseases in a hypertensive patient. However, here is the you can take a screenshot of it, and I am using this one in croc question. Maybe you know some different classification. You know that the data keeps on changing, so no problem about it at all. Next is rheumatic fever. So rheumatic fever is the inflammatory disease that can develop a lot of complication if left untreated. So what happens in rheumatic fever is it is a streptococcal throat infection. The streptococcal will give you tonsillitis, and if it is left untreated, then it will catch the new symptoms. The patient will catch the new symptoms like the rheumatoid arthritis even. So you can see some symptoms here. The question in the rheumatic fever questions will highlight you the pain in the knee or ankle joints or elbow joints. Symmetrical pain will be there, migratory pain, severity pain, less normal joint, x-ray will be normal, like that. So symptoms we can see carditis, arthritis, chorea, erythema magnetum, subcutaneous nodules. So you can see all of them. I hope you know already about the triad of the rheumatic fever. So first will be a history of streptococcal throat infection or tonsillitis. Then will be the pain with the joints. Some joint pain will be there, and third will be the systolic murmur will be there. So this is the triad for the rheumatic fever. Or let's say the acute rheumatic fever or let's see the case. In the case, they are asking about what drug to be prescribed for the prevention of secondary rheumatism. So this is the direct question of the croc. I know that you will be able to solve the question related to acute rheumatic fever, but this is a bit different, that the question is asking about the prevention, that we want to prevent the reoccurrence of the disease. So for the prevention, we will inject Bacillin 5 injection to the patient so that he will be able to prevent the reoccurrence of the rheumatic fever. So Bacillin 5, remember, is a injection which is a sort of vaccine to prevent the rheumatism. Treatment, if you want to treat the rheumatic fever: penicillin, antibiotics, corticosteroids, for example prednisolone, you can use them. Next is pericarditis. Pericarditis is the inflammation of the pericardium sac, which is a thin sac-like membrane surrounding the heart. Can occur suddenly, acute. It can be acute, or can develop gradually, or it can be chronic. So symptoms, we are going to see a sharp stabbing chest pain. This time the pain is stabbing. In last pathology, the sharp and stabbing pain was not there yet. So it will worsen when the patient will deep breath or lie down, because the patient is having some fluid in the pericardial sac. So just take a deep breath. So just think, if there is in when you are taking a deep breath, so a lot of air will be there in the thoracic cavity, and since the heart is already having some congestion due to the pericardium fluid buildup, so there will be a more severe pain if we inspire more, right? So the pain will improve on sitting up and leaning forward. The examiner may use these points that the pain improves or leaning forward. However, I'll let you know the case very well. Fever, fatigue, shortness of breath, pain radiates to the shoulder, neck and back. Let's see the case studies. The first patient is 82-year-old, says about the sharp pain. So they are talking about the stabbing pain, yeah. Behind the sternum, lack of air sensation, weakness, transverse size cardiac shadow. This transverse size cardiac shadow, I'll throw a reel on YouTube as well in order to highlight this cardiac shadow in the cases of pericarditis. However, you know that heart can be, you can consider the heart as a triangular way, and just know that if the pericardium sac is having problem or inflamed, if there is any sort of inflammation over there in the pericardium sac, so you are going to see something triangular, right, on the x-ray. However, I'll show you the x-ray later. Rounded cardiophragm corners. Cardiac contractions are small in amplitude and arrhythmic. So you know about the question already. It is the case of exudative pericarditis. So next question says that the patient had influenza a week ago. Now he is facing fever, slightly elevated BP, pulse is high, and biphasic murmur. So biphasic murmur something means the pericardial friction rub. All right. So when the pericardium is friction rub is present, then you will go with the acute pericarditis. However, you will have to understand this, that biphasic murmur is the character which highlights the pericardial friction rub, right? In the third and fourth intercostal space, heart sound are sonorous. ST elevation, this is something important to understand right here, that ST elevation we see in the case of MI plus in the cases of acute pericarditis as well. We are going to see the ST elevation, because due to the fluid buildup in the pericardium sac, the patient is unable to have enough pumping or cardiac output. All right. So I hope you will remember about pericarditis. Only 2 questions in croc. However, you can see the pericardial friction rub in more questions of the test center, so you will be sure about pericarditis somehow. Let's see the next patient. There are some cardiology questions itself, which I thought to include in the same video. So let's see them. You can read the whole question. Okay, let's do it together. 64-year-old patient having undergoing outpatient treatment for the ischemic heart disease, diffuse cardiosclerosis, persistent atrial fibrillation, and the functional class 3 heart failure. A lot of things are there. The patient is in the Graves condition. Pharmacotherapy consists of amiodarone twice a day, toracimide every day, and this every day. So family physician recommended to take warfarin, which is a clot breaking thing, to prevent the thrombus formation. Yeah, so to break the thrombus formation, they prescribed him this. So what parameters should be measured in this case for the optimal control of and effectiveness and the safety of the anticoagulant therapy? The question is asking about what parameters should we measure for the optimal control of the effectiveness of the safety of the patient, safety of the anticoagulant therapy. Yeah, so this is international normalized ratio. Remember that there is a direct question in the croc over this INR. And what is INR? So sir, INR helps to check that if the blood is not so thick or not so thin, because both of the things are problematic. Yeah, if the blood get too much thin, that is also a problem. If the blood get too much thick, that is also going to cause plaque formation, so or clot formation. So there are both of the things are problematic. Just remember that INR ratio we use to check the blood thickness as well as the thinness, so it should be in the ranges of norms. Next patient is of patient of ischemic stroke in the right hemisphere of the brain, says 10 days ago, this and this and this. So suffers from the moderate arterial hypertension, arterial fibrillation, urolithiasis, gout. I hope these all the pathologies are not new for you anymore, because if you are watching my videos, I have explained the hypertension, I have explained the fibrillation, I have explained the urolithiasis, I have explained the gout as well. So let's see what the patient is asking. What must be prescribed to the patient for the secondary prevention of the stroke? So stroke I have explained as well. Okay. So we are going to prescribe oral anticoagulants to the patient, so that there is there will be no clot buildup in the patient, or there will be nothing like a plaque or clot will build up. So the best which is according to me is apixaban here. So oral coagulants, these were all were given in the question. So warfarin plus NOAS and apixaban and this rivaroxaban, so all of them were asked by the examiner. So this was the whole option. So you will prescribe oral anticoagulants to the patient so that the stroke can be prevented. All right. Next is some basic portion for the ECG. So let's start. So this is a ECG lane highlighting the PQRST waves. So let's see what is the first thing written over here. So P wave described the depolarization, which means the arterial contraction. The QRST complex determines the ventricular depolarization. The T waves highlights the ventricular relaxation or repolarization. Let's just have a look over the intervals. If you find them important, you can remember them. In some of the question of the croc, they say about this and this QRS complex is extended by this and this time. So maybe it's important for you to remember about the norms of the segment. The P wave, after the P wave, so PR interval is something from the where the impulse is getting transmitted from the arteria to the ventricles, which is 0.12 seconds to 0.20 second is normal. All right. And QRS complex is the highlight of ventricular depolarization, which occurs in 0.06 to 0.10 seconds. So I saw the direct question over in the croc that they were saying something about the paroxysmal ventricular tachycardia. I remember the case now, that they were showing that the QRS complex is extended. In the bracket they have given that it is 0.13 seconds. So 0.13 second was extended. Yeah. So, you know from now that how much is the normal norms of the QRS complex is 0.6 to 0.10. The T wave shows the ventricular relaxation. So let's talk about the ST period. ST period is the period between the ventricular contraction as well as the relaxation. So ventricular depolarization and repolarization is thus highlighted by the segment ST. QT segment indicates what? It's the time for the depolarization and repolarization. QT segment is the time for depolarization and repolarization, which is 0.35 to 0.45. However, ST segment is the period between the ventricular depolarization and repolarization. They are tricky tips, yeah. You will remember, I hope. Next. Just the basic we are talking about, guys, so that first of all, I thanks to Miss Solomko and Miss Avramenko from the university, Kiev Medical University, that due to both of these teachers, I finally come to know where are the hands of ECG and where are the legs of ECG. So before reading out this table, I really want to thank to Miss Solomko and Miss Avramenko. This table is given by Miss Avramenko, and after knowing about this table, I'm so happy that I come to know about the ECG finally. And we did a lot of case studies for ECGs with Miss Avramenko and Miss Solomko. So a very big thanks to both of these teachers that I finally understand ECG a bit now. However, let's look at the ECG. So we will just learn what I know about the ECG. So how to look at ECG? So we look at ECG. First of all, the first thing to think in the question is the first point is negative P wave and negative T wave in the lead AVR is normal. You know that P wave should be positive, right? So if the P wave is negative and T wave is negative in the lead AVR, so the ECG is normal and the ECG is the valid. So second thing which you are going to see in the question is rhythm is regular or irregular. So you are going to count the RR intervals in the lead 2. So 300 divided by the RR intervals will be the rhythm or the heart rate. So you are going to calculate heart rate, which is written in the third point. And fourth point is check if P wave is present in all the segment. So if it is sinus rhythm or not. So fourth point states that check the P wave should be present in all the cases. So fifth is PR intervals. PR intervals should be less than 5 boxes, which will be normal. So you have to count that in lead 2. And next is look at all the QRS complexes, if they looks like previous one or if there is any case of premature ventricular contraction. Seventh point is QRS complex if they are broad or normal. Look in the same lead, look at all the QRS complexes, that if they are looking the same or if there is they are broad or normal. Yeah. In the eighth point, you are going to remember the name of you are going to name the waves. So this is the point which you are doing it for yourself. So name the waves for yourself, that P wave is this, QRST complex is this. So after that it will be easier for you to solve the case. And in the ninth point, it states that ST segment is elevated or depressed. So you have to check about if it is STEMI or non-STEMI. And check if the T waves are present, T waves are positive or negative. In the last 10th point, you are going to check the QT segment, check about the norms of the QT segment. So let's go next. This is my ECG. So you can use your skills that how to look at the ECG, and this is my ECG. So you have a chance to check how my heart is beating exactly. So this is the wave 1, 2, 3, wave AVR, AVL, AVF. This is the wave V1, V2, V3. This is the wave V4, V5 and V6. However, the ECG is this ECG was taken 2 years ago, and let me know in the comments if you find anything abnormal in my ECG. It's a bit blur because it was taken 2 years ago, but you can take the screenshot and let me know in the comments how do you know now that how my heart is beating, or if you diagnose some problem over there. So let me know in the comment section. This is page 1, page 2, page 3, page 4. Questions we have done. So this is it with this video. I hope you are not scared of cardiology anymore and you will be able to solve all the questions in the croc exam. And let me know if there is an incorrect something, if you are marking still. So let me know in the comments. We'll discuss it straight away. So see you in the next video.